Hello, my name is Dr. Vikram Gupta. I'm a practicing physician in New Jersey, and today we're going to talk about the craze about this new weight loss medications called the GLP1-RA. People do have a lot of questions and hesitations and excitement about this drug, so we're going to talk more about this, about the pros and cons, and is it the right medication for you? So GLP-1 is basically a new kind of injectable drug that mimics the hormone GLP-1 in the body, which usually regulates how long food stays in the stomach before it gets digested and moves to the intestines, and also how much insulin is released for metabolizing sugar in the body, and also tells the brain when you are hungry and when you're not. So this medication tricks the brain into basically thinking that you're always full, or more frequently you're full, and does not make you hungry, and gives you the sensation that your stomach is full despite the fact that there's nothing in it. As a result, people eat less, and when you eat less, you definitely lose weight. Recently, I had a 44-year-old woman who has 3 children, no other medical problems, but has been suffering with her weight for about 10 years now, and wants to lose about 20 pounds, and has tried many different exercises, many different weight loss pills, many different exercise programs, but just cannot seem to lose that extra 10 to 15 pounds. And she's getting very frustrated with this and has low self-esteem and almost depressed because of this weight loss. And then she saw this advertisement on TV and some of these friends using a certain drug, and she comes and asks me about this, what is this new class of medications for weight loss, and I would like to be prescribed it. So we had a long discussion about this, and she had a lot of very interesting questions, and I think everybody could benefit from that. Another question I get asked is, can I use it in conjunction with other weight loss medications? There are some other weight loss medications that have been out there, and people have tried many different approaches to weight loss with the idea of either not eating much, feeling more full, or not digesting the food that you eat. Some medications will disrupt the digestive process and let the food go undigested. So they have tried like different mechanisms of the concept that if you eat but you will not gain weight, it usually ends up having a lot of side effects, or just the quality of life still suffers, and you're trying to bypass the natural digestive process, which is not a good idea. So usually I have seen in my patients that they don't really need to mix it up with other medications for weight loss. That is a discussion for another time, but it is recommended to use these medications along with exercise. And in my opinion, the best way to use these medications is to use it as a kickstart to a reasonably appropriate, healthy diet and exercise regimen. One would need to create a negative deficit in order to lose weight, which means that you're burning more calories than you're consuming. So this medication kind of helps in this process by allowing you to consume lesser calories by not feeling hungry all the time. And when you go to the gym, or you start even simple exercise like walking or going up and down the stairs, you're burning more calories. So that is an essential component of weight loss in this, that it helps you kickstart. What are some of the downsides of this medication? The most common downside that I've seen is it's not permanent. That means you have to stay on this medication to maintain that weight loss. Because once you stop taking this medication, let's say after 6 months you decide to stop, or after a year, whether it's because of nausea, whether it's because of any other reason, you decide to stop taking this medication, your concept of hunger will change, and you will tend to get hungry more naturally as you've always been, and as a result the weight can start coming back. So you have to stay on this medication to maintain that weight loss. Now, that being said, the right way for my patients who have maintained a certain amount of weight loss and later having stopped this medication is that they started this medication, but then that helped them understand how much food they really need in the course of a day. They were able to increase their exercise, and they were able to change their lifestyle. Now, when you change your lifestyle and slowly take this medication out of your system, you still have a certain routine, a certain exercise regimen, certain times that you don't eat anymore, and then your weight gain is minimal after stopping it, and you are living a different lifestyle. But the other patients who just relied on this medication but did not change anything else, yes, they also lost some weight, but then they gained it right back after stopping the medication. Another big issue with these medications is they're very expensive. A month's worth of this medication can cost about $800 to maybe $1,100, and it requires a prescription. You cannot just go and buy it over the counter. Now, that is a significant cost to be on this medication, and insurances are giving us a hard time covering these medications even for patients who have diabetes, and they're not, as of now, February 13, 2023, as of now they're not paying for these medications as just a weight loss medication, and people without diabetes are not being able to get this medicine. I'm having a lot of difficulty in getting this medication just for the people who already have diabetes. So that's one of the hurdles for patients who can definitely use this medicine, but they're unable to, because I think $800 to $1,200 a month is significant commitment, and it has to be sustained over months. So that's one of the biggest hurdles right now for this medication. Now, for patients with diabetes and who could benefit from weight loss, the insurances do offer coupons and savings and different ways to help assist with the high copays that they might be associated with these medications. But that's still on an individual basis, on what kind of insurance you have, what kind of deductibles you have. So that's more specific to each patient and each person. Now, the other question I keep getting asked is like, what about the use of these medications in people with other health conditions like heart disease, hypertension, and hypothyroidism? Well, technically, these people have done just fine with these medications, and most of my experience has been with people who have diabetes, but some of the patients have tried this medication without having underlying diabetes, but they've had high blood pressure or high cholesterol, and I noticed that they actually did benefit from this as well, because the less food you eat, lower your cholesterol is going to be accordingly, and you're eating less and you're losing weight, so this will help benefit blood pressure and your cholesterol. Obviously, it's not going to affect your thyroid, and for the heart, usually the less weight you carry, the less work it has to do. Obviously, your doctor will discuss your health conditions, the medications you're on, and if there's any interactions and if there's any particular concerns about your medication, but for the most part, they have been relatively safe. How are these medications taken? I mentioned that these are most commonly available as injectables, so it's a very tiny injection that the person has to administer themselves, or someone else can do it for them. But these are the smallest tiny needles, and they usually will come as a pen, and some of the medications have a built-in mechanism, a special pen that basically you click a button and it does all the rest on its own. And so it's very simple to use for anybody at all. And to learn this, there's many videos on how to learn this online, or every pen-like injection that you get, it comes with its set of instructions. So these are some of just the very basic questions that I've tried to touch upon, since a lot of my patients as well as their family members have had this question as what is this new weight loss drug that everybody's talking about. I can always get into more details, and there's always more about these drugs, and just remember that they do need to be tailored to everyone's needs, and it may not necessarily be the right drug for you. But in general, this is a new generation of drugs that has a lot of potential and helping people with obesity and obesity related medical problems. If you have any further questions regarding the GLP1-RAs, please talk to your doctor, who can always help you tailor these medications to your particular needs. And please don't forget to comment, like, or subscribe to this video, and I'll see you with the next one.